Welcome, everybody. Listen, if you're anywhere near retirement, this is something you absolutely need to hear. Today, we're going to break down exactly what you can expect to pay for healthcare in 2026. And we're going to uncover the one single biggest cost that, honestly, most people just don't see coming.
So let's just get right to it. What will your healthcare actually cost in 2026? You know, it's so much more than just that monthly premium you see. To really get the full picture, we're going to look at three key numbers. And trust me, these numbers, they tell a pretty powerful story.
Okay, first up, $202.90. So what's that? Well, that's going to be your new standard monthly premium for Medicare Part B, the part that covers your doctor visits and things like that. And get this, that's a jump of almost $18 from 2025.
All right, next number, $1,736. Now, if you end up in the hospital, this is your new deductible under Part A, and it's for each benefit period. So, what's a benefit period? Basically, it kicks off the day you're admitted and only ends once you've been out of inpatient care for 60 straight days. It's that first chunk of money you have to pay out of pocket before Medicare starts picking up the tab.
And then there's this number, $119,340. What's that? Well, that's the estimated average annual cost for a shared room in a nursing home. I want you to burn this number into your brain because it represents the single biggest financial risk most retirees face. We're definitely coming back to this one.
Okay, so let's dig into the details a bit more. These are the official numbers for 2026, straight from the Centers for Medicare and Medicaid Services. This way, you can see exactly where every dollar is going.
So you can see right here how things are changing year over year. That Part B premium, yep, it's up to $202.90. The annual deductible for Part B, that's now $283. And that big hospital deductible we just talked about for Part A, $1,736. Look, these are the absolute foundational costs that everyone on Original Medicare needs to have on their radar.
But hold on. For some of you, that standard premium we just talked about, that's not the whole story, not even close. If your income is above a certain level, you're going to face an extra charge. And this brings us to a little something called IRMAA.
So what in the world is IMRA? It stands for Income-Related Monthly Adjustment Amount. Yeah, it's a mouthful, but really all it means is it's a surcharge for higher earners. Here's how it works. Social Security looks back at your tax return from 2 years ago. So for your 2026 premiums, they're going to be looking at your 2024 tax return to see if you have to pay extra.
And this chart here really breaks it all down beautifully. Just find your 2024 income over on the left, depending on how you file your taxes. Then, just follow it over to the right to see your total Part B premium. So, for example, if you're single and made up to $109,000, you're paying that standard $202.90. But if you made just a bit more, say between $109K and $137K, boom, your premium jumps to over $284. And as you can see, it just keeps climbing from there, all the way up to almost $700 a month for the highest earners. And this is really important. A similar surcharge gets tacked onto your Part D prescription drug plan, too.
Okay, now we need to talk about what is, without a doubt, the most misunderstood and, frankly, the most financially dangerous part of Medicare. And that's what happens after you leave the hospital, but you still need ongoing care. First things first, we have to get really clear on what Medicare calls skilled nursing care. This is not just general help around the house. We're talking about specific medical treatment ordered by a doctor. Think physical therapy or complex wound care, stuff that absolutely has to be done by licensed professionals like nurses or therapists.
Now compare that to something called custodial care. This is completely different. This is non-medical help. We're talking about assistance with daily activities. Things like bathing, getting dressed, eating. And this right here, this is what most long-term care actually is.
And this is the absolute key distinction you have to understand. Medicare was built to cover medical treatments. So yes, it might help pay for that skilled nursing care after a hospital stay. But, and this is a huge but, it was never designed to pay for long-term custodial care. This is hands down the single biggest gap in Medicare coverage, and honestly, it can have absolutely devastating financial consequences.
And you know what? Even for the skilled care that it does cover, you're facing what's called the 100-day cliff. Here's how it works. For the first 20 days in a facility, Medicare pays 100%. Great! From day 21 up to day 100, you're on the hook for a daily copay of $217. Okay, but what happens after day 100? You pay for everything. 100% of all costs are on you. You fall right off that cliff.
So,
If Medicare isn't going to cover that long-term custodial care, the big question is, what does it actually cost when you have to pay for it yourself?
Remember that number I asked you to burn into your brain? Let's bring it back. $119,340. That, my friends, is the nationwide average for just one single year of care in a shared nursing home room. Think about that. For most people, an expense like that could wipe out a lifetime of savings in just a couple of years.
But here's the thing about a nationwide average. It can be pretty misleading because where you live changes everything. I mean, just look at this. The average annual cost in Texas is around 70 grand. Head over to Florida and it's over 133,000. And then you go to Alaska and it's a staggering $390,000 a year. That's more than 5 times the cost in Texas. That's exactly why you have to know what the costs are right where you live.
Okay, so when you're staring down these potentially huge costs and you see these massive gaps in Medicare, the obvious question is, what do you do, right? How in the world do you prepare for this? How do you bridge that gap?
Well, one really common tool people use to handle out-of-pocket costs is Medicare supplement insurance. You've probably heard it called Medigap. Basically, it's private insurance you buy to help pay for the stuff original Medicare leaves behind. You know, deductibles, co-insurance, things like that. It makes your costs way more predictable. But, and please hear me on this, Medigap plans have to follow Medicare's rules. What does that mean? It means they generally do not cover long-term custodial care.
Just to give you a feel for how these plans work, let's look at 2 of the most popular ones, Plan G and Plan N. They really show you the kind of trade-off you're making. With Plan G, you pay a higher premium each month, but after you hit your Part B deductible, it covers pretty much everything else, super predictable. With Plan N, you get a lower monthly premium, but you'll have to pay small copays when you go to the doctor or the ER. So it's really a choice. Do you want to pay more upfront for that predictability, or pay less each month and handle some small variable costs as they pop up?
All right, I know that was a ton of information, so let's boil it all down. What are the absolute most important things you need to remember for your own financial planning?
Here are the 3 big takeaways. Number 1, your basic Medicare costs for Parts A and B, they're going up in 2026. That's a fact. Number 2, the single biggest financial grenade for a lot of retirees is that Medicare does not cover long-term custodial care. And number 3, tools like Medigap are great for covering your immediate medical costs, but it is absolutely essential to know they do not cover that long-term care gap. That's a problem you have to solve separately in your financial plan.
So all of this leaves us with one final, really important question that only you can answer. You know, retirement planning isn't just about saving for the fun stuff like travel and hobbies. It's about building a plan that's strong enough to handle the real and often shocking costs of healthcare. So you have to ask yourself, is your plan truly ready?